And what we know is that actually 80% of our health is determined socially. So not biomedically, clinically, but socially. So given what we know about the societal influence on our health, it really makes sense to think creatively about how creative approaches to health could support people to live healthier lives. Hi, I'm Helen Chatterjee. I'm a Professor of Human and Ecological Health at University College London, and that basically means I look at the interactions between the health of humans and the environment in which they live. I'm also a trustee of the National Centre for Creative Health. Creative health describes creative approaches and activities to promote health and well-being. I think about creative activities not just being, for example, art making or creating a pot, for example, but also creative approaches to thinking. And also then, wider than that, creative approaches to health creation within individuals, within populations, but also within society. Well, it could include activities you're doing in your own home, for example, or within the communities. That might be engaging in arts activities down your local community centre, going to the knitting club, doing the flower arranging, doing art making classes, for example, dance classes, singing, your choir, your social clubs. It might be about what's going on in your museum or your library or your local community centre, or what social clubs are available to you, what social networks are available to you. But also nature-based activities, what's going on in parks, for example, and a lot of those might involve creative engagements with nature, say through poetry or through drawing. I think there's really interesting possible research around mindfulness, meditation, and the way that you are focused on activities, what that means in terms of what's happening in your brain when people are creatively engaged. There's a lot of evidence, particularly from neuroscience, that suggests that actually that is very linked to this idea of being completely cognitively and psychologically immersed in a task. That helps you enter into a more meditative state. We now have a really big evidence base to show the many benefits of a creative health approach to thinking about both prevention strategies and also more effective intervention strategies. And so what we're keen to do is think about how can we scale that up to make it available to everybody in the population, not just the people who can afford it, but particularly how could we scale that up for the people in the poorest areas. The people living in the poorest areas with the poorest and the lowest incomes, living in the most deprived areas, have the worst health outcomes, and we see very large life expectancy differences of 10, 15 plus years for those individuals in those categories. So unless we address those underlying social factors, we're never really going to be able to tackle the major health issues that we're facing in our society: heart disease, diabetes, high blood pressure, obesity, mental ill health. So again, we know that creative health approaches help to engage all of those major health conditions. People talking positively about feeling better, people's perceptions of how isolated they are, tackling loneliness, feeling more cognitively engaged or alert, reductions in things like agitations, people talking a lot about gaining a sense of identity, that the tasks have helped them to think creatively about their life and their circumstances, and that sort of sense of agency that can give an individual, the kind of hope, the optimism, the confidence. I mean, loneliness is a huge issue, and that idea of a sense of isolation, dislocation from society, or a sense of community, and I think arts and creativity has got a huge role to play there. A lot of our work has been with older people or with people who face particular health conditions which mean they might be isolated, say stroke survivors, for example, so they might be restricted in how they can move, getting out of their home, for example. Older men tend to report issues around loneliness and isolation. Also the links between loneliness and isolation and dementia, so cognitive decline. We see that massively in terms of the male population, particularly a massive drop-off post-retirement. The evidence shows that when people have the opportunity to engage, whether it's in person or online, and that there's a creative component to that, that social creative opportunity really provides people opportunities to improve their psychological and subjective well-being. But also young people, there's been a dire effect given the removal of arts, creativity, lack of access to the outdoors, lack of access to physical education within the school's curriculum, and we're now seeing knock-on effects of that. Students are way less informed and than they were 20 years ago, And I think it is a direct result of having all this stuff removed. They're less able to connect up and do lateral thinking, critical thinking, complex synthesis. People talk a lot also about having creative opportunities for learning, and I think that's a really important part of loneliness. Again, that sense of agency, so you're doing something creative but you've learnt about yourself. For young people, I think thinking about that within the school's context, within the extracurricular context, within the social context that they're operating in. We know that there's lots of negativity around being immersed in social media, but perhaps there could be creative ways of thinking about how individuals are engaged in that, rather than perhaps the well-reported negative aspects of that. We know that if we prevent ill health early, it's going to improve people's lives, but also save a lot of money. And we know that the root cause of a lot of ill mental health is around loneliness and isolation. So if we can find creative routes to tackling that, we can also help solve some of these big problems. Everything's so degraded and we've been so eroded back, particularly around health, around this biomedical model, which doesn't work effectively because our population, okay, it lives longer, but it's unhealthier and unhappier. So we're doing it wrong, aren't we? We've got to do things differently.